I see we've got people coming in. Thank you for joining us today. And we're going to give people another few seconds, and then we're going to go ahead and get started. All right, so we're going to go ahead and get started. I want to say thank you for joining us today. You've joined Cal's webinar, English for Occupational Purposes, Language and Policy Issues for Healthcare Professionals. The recent global pandemic has drawn attention to acute shortages of healthcare professionals in North America. This webinar will focus specifically on the challenges facing internationally trained healthcare professionals. Thank you once again for joining. Hello and welcome to you all. My name is Althea Rowe. This webinar is part of our Critical Conversations, Research to Policy and Practice series. This year, Cal is hosting live virtual discussions with educators, policymakers, and administrators exploring what it means to take an assets-based approach when working with multilingual learners and how an equity perspective can and must guide local, state, and national policy across different educational settings. Okay, just a few housekeeping notes before we begin. This webinar is being recorded and will be posted onto www.cal.org after this event concludes. Also, a reminder that the views, thoughts, and opinions expressed during today's webinar belong solely to the person or persons expressing them and do not necessarily represent the views of the Center for Applied Linguistics. We encourage you, the audience, to ask questions via the Q&A box below. We will address as many questions as we can at the end of our discussion today. Also, you may click on the chat button at the bottom of your screen at any time to share your thoughts and comments. Go ahead, try us now. Tell us where you're calling from. Now, I'd like to introduce our moderator for today's webinar, Brian Morgan.
Thank you, Althea. There's two of us moderating today. We also have Kate Moran. I'd like to first introduce our two speakers, Andrea Strawn and Jake Hofstetter. Andrea is the Director of Learning and Simulation at Touchstone Institute, an organization that develops and administers competency assessments and education programs for internationally educated health professionals in Canada. Andrea's led research projects focusing on the language and communicative demands of professional practice. She's also developed English for specific purposes curriculum assessments and has worked with regulators on language policies for international applicants for licensure and registration. Jake Hofstetter is an associate policy analyst at the Migration Policy Institute's National Center on Immigrant Integration Policy. At MPI, Jake conducts research and policy analysis to promote the long-term civic, economic, and linguistic integration of immigrants and refugees, with a focus on adult education and workforce development policy. So thanks for joining us today. And I think we all agree that this is a really timely topic, especially after 2 years of the pandemic. My first question goes to you, Andrea, and we'd love to hear about your work at the Touchstone Institute. Could you tell us how it addresses issues of assessment and licensing requirements of internationally trained healthcare professionals?
Thanks, Brian, and thank you, Kate and Jake and Althea, for having me here. It's really great to join a discussion on, how to gain some clarity and promote fair access to linguistically and culturally diverse people who come to North America to contribute their skills in our healthcare system. I'm just going to give a little bit of background about Canada and the context in which I work. So health professions here in the province of Ontario in Canada is regulated through colleges. These colleges oversee member qualifications and therefore their registration and then eventually their conduct. The role of colleges is to protect public safety, and these colleges are subjected to the Ontario Regulated Health Professions Act. And that's important to understand that there's actually a legal framework around this. But when operationalized, some of these licensure requirements can surface as barriers. such as the inability to access graduation documents when these graduation documents are necessary. So refugees sometimes face this, or the requirement for Canadian experience, which has been the case, or even clarity regarding competency gaps if you don't pass exams, or understanding why a language proficiency test, or even understanding the differences in the host culture, such as competency-based examinations, why we have regulation around health, and even in Canada, for example, a public healthcare system that's patient-centered. So just give you a couple of examples that might help this group who works in language. So an English-speaking African nurse who's required to pass an English language proficiency exam might wonder, why do I have to take an exam? The regulator, on the other hand, needs to check off that box of the language proficiency. Or a very experienced international professional whose academic credentials don't match those in Ontario, but whose formal and informal learning in the workplace is not fully recognized, might be really frustrated. So several initiatives emerged over time to improve registration processes for internationally educated health professionals here in Canada. And this includes a lot of the programming that we're responsible for at Touchstone Institute. We were created originally as an assessment for clinical performance-based assessments, what we call OSCEs. And we're currently a site for national standardized examinations for the competencies of international physicians trying to qualify in Canada. We also deliver an orientation program to international medical graduates who have actually qualified and who are entering residency. So this addresses some of those social cultural issues that you might face as an international professional, such as local standards for prescribing tests and medication. These will differ from country to country. So IMGs, or international medical graduates who come to programming, gain some confidence and do some networking before they enter there. We also design and deliver competency exams for nurses who haven't qualified based on document reviews, but then they have a chance to do a competency assessment to demonstrate their skills and be recognized. And of particular relevance to this group might be our signature language proficiency exam, the Canadian English Language Benchmarks Assessment. So this is a very unique assessment in our environment. It's the only occupation-specific language test here in Canada that is used by nursing regulators, by any actually health regulator, to demonstrate evidence of language proficiency. And Brian, thank you for finding our article in TESOL Canada, because we did speak a little bit about some of the challenges we face as an occupation-specific language assessment. We're developed in consultation with our Canadian language standards, the Canadian language benchmarks, with nurses, and we've grown from an administration at a local college to administration at Touchstone Institute, which has a bigger infrastructure. And over the pandemic, we went global, we went virtual, and that was an amazing success. But we do experience challenges. We compete with IELTS, TOEFL, and the OET. These are huge assessments. We have little funding support. We have a small group of people, about 2,000 a year. So sustaining and developing the exam is rather challenging. And of course, we're vulnerable to some regulatory policy changes, some of which we'll talk about later on today.
Okay, thank you, Andrea. I'll turn over to Kate now.
Sure. Yeah. Thank you, Andrea. And Jake, I want to get your views. We've just heard about the Canadian context, and I was wondering if you would talk to us about the research the Migration Policy Institute has conducted regarding similar concerns in the United States.
Of course, thanks, Kate. It's hi, everyone. It's great to be with you. So yeah, as you mentioned, I'll just talk a little bit about the research that we've done at MPI in this space, and then I can talk about some recent policy developments in the US connected to internationally trained healthcare professionals in the past few years. So for those of you who aren't familiar with us, the Migration Policy Institute is a nonpartisan think tank based in Washington, D.C. As an organization, we seek to improve immigration and integration policies through authoritative research and analysis, opportunities for learning and dialogue, and the development of new ideas to address complex policy issues, such as the issue of the skill underutilization of internationally trained healthcare professionals. So the Migration Policy Institute, particularly my colleagues Zhanna Badalova and Michael Fix, have done a significant amount of research into the issue of internationally trained professionals, or ITPs, including in the health space. So over the past few years, our institute has published a number of different data analyses, briefs and research reports on the challenges of ensuring the professional success and economic integration of immigrants who are internationally trained professionals. Those resources have been or will be provided as links along with this webinar, but you can also find them along with other research and data we have on this issue on our webpage. And just thinking outside of our research, as an institute, we've also engaged more broadly in efforts to support states looking closely at these issues and worked with national groups in the United States, such as the World Education Services, which I believe also works in Canada as well. So our research and our work in this space has been largely focused on the phenomena of what is known as brain waste, a concept termed by my colleagues to describe the state of immigrants with college-level education and professional qualifications working in low-skilled jobs, which some also term underemployment or skill underutilization. So our research indicates that approximately 2 million individuals in the United States are affected by such underemployment, representing a significant loss of skills and talent that could otherwise be incorporated into various US sectors and industries, as well as the economy more broadly. So as you can explore in our research, the causes of brain waste are complex, but include different issues such as limited proficiency in English, but also, as my co-presenter noted, the similar challenges that many immigrants and refugees face in transferring their credentials, degrees, and other professional qualifications in the US context. Efforts to transfer these various qualifications and degrees, both in the healthcare space and outside of it, are complex, time-consuming, and also very expensive as well. So just turning quickly to the healthcare space and looking at internationally trained healthcare professionals, MPI has also done a significant amount of research on this topic, especially as it relates to the COVID-19 pandemic. So with the shortages in medical professionals, including doctors and nurses during the pandemic, many states and policymakers in the United States thought to turn to immigrants who were healthcare professionals in their own country, but not employed in the industry in the United States or working in different jobs in the healthcare industry to help combat the pandemic. So our research indicates that before the pandemic began, there were approximately 270,000 immigrant and refugee healthcare professionals, either employed in jobs that required no more than a high school education or were out of work, i.e. these were internationally trained healthcare professionals whose skills were not being utilized, especially in the context of this really urgent public health emergency. With the health emergency, though, bringing these individuals into key roles, such as working as doctors and nurses, took on a greater urgency. And again, I just want to encourage you to check out some of the resources on our website to find out more of the details on how this became more salient during the pandemic. But what I do want to note as well is in the US context, some of the both state level and national level efforts, both within the pandemic and outside of it in recent years, to help integrate internationally trained professionals, both those in the healthcare field and those outside of it, into the American economy. So during the pandemic, as we noted in our research, several states in the United States, including Colorado, Idaho, Massachusetts, Michigan, Nevada, New Jersey, New York, and Pennsylvania, began efforts to ease licensing requirements to allow more internationally trained healthcare professionals to work on the front lines of hospitals and other healthcare settings during the pandemic. So these efforts generally relaxed some element of licensing in the states and allowed individuals to apply through specific pathways to be able to work in professions during the healthcare emergency. So the requirements and nature of these initiatives differed from state to state, but you can find more information in our policy brief entitled Brain Waste Among U.S. Immigrants, Health Degrees, a Multi-State Profile, which will also be shared along with this webinar. So unfortunately, these programs did not lead to a very large number of internationally trained professionals with healthcare backgrounds being employed during the pandemic. However, they do represent promising models for the future, as well as an acknowledgement by states of the value of internationally trained healthcare professionals that they could bring to the industry in their particular state. And just the two final things I want to note in terms of policy initiatives in the United States that may be of interest as well. So on a broader level, states have begun to work on issues related to skill underutilization and finding ways to solve that challenge. Notably, both Maryland and Michigan have ongoing programs intended to help underemployed internationally trained professionals, including in the healthcare space, to get their credentials recognized and move into critical areas of employment in their states. It's also really notable that at the federal level, we also had the recent passage of bipartisan legislation in the US Congress. So the Bridging the Gap for New Americans Act was recently passed with bipartisan support, which attempts to address this issue of internationally trained professionals, including those in the healthcare space, by requiring the Federal Department of Labor to conduct an interagency study on the factors that impact employment opportunities in the US for work-eligible immigrants and refugees with professional credentials from their home country. So the Department of Labor will also be required to issue policy recommendations to Congress to help these individuals unlock their full potential and find high-quality jobs in critical sectors of our economy. So again, a lot of movement on this issue in the space, including both from the pandemic and as well as from this new act. And yeah, I'm really happy to dive into the rest of the details as we continue on in this webinar.
Thank you, Jake. That question, I want to take up your discussion of skill underutilization for Andrea in the Canadian context, and the kinds of complex roles and sometimes barriers created through professional associations and other organizations like universities. So, Andrea, could you speak to this idea of Jake used those terms, brain waste and skill underutilization? What's your experience in the Canadian context?
Well, of course, as an organization that's worked in this environment since 2007, we're keenly aware, right, of this skills utilization. And the work that we do is one of the ways in which we have tried to address the notion of assessing your competencies in an alternative format, as opposed to relying on, for example, documentation, paper-based assessments. So having a performance-based assessment allows an internationally educated nurse, for example, to demonstrate what they can do. And Canadian nurses function as examiners, and they can therefore check their competencies. These kinds of exams will yield a good number of successful candidates who will then go on to perform successfully in the Canadian healthcare system. And then others who haven't met the Canadian competencies can make other decisions, maybe become a licensed practical nurse, a personal support worker, or choose other alternatives. So in that kind of a middle ground, right, with helping regulators meet their requirements, but also helping internationally educated health professionals demonstrate their skills in an alternate way beyond document verification. But I think I want to follow up a little bit on what Jake has said around policies, because I think there's something really interesting happening in Ontario. We do have here an Office of the Fairness Commissioner. So within our province, that Office of the Fairness Commissioner has advocated for change in legislation. So recently they have waived the Canadian experience requirement, because one of the barriers was you needed to spend X number of months working in a Canadian environment, getting a check off, showing your language proficiency, and then working. So that held a lot of skilled immigrants back. The other thing that that has been happening is that the sector or the Ontario Fairness Commissioner advocated for aligning the language proficiency exams between immigration and registration with your regulator, because it has been two different exams. I'll give you an example. IELTS general training is used for immigration. IELTS academics usually used for registration. So an immigrant has to take two exams and meet two different standards. So they're now working towards aligning these. The other thing that's been happening lately is that government here in Ontario, and we see it across the country as well, is working with hospitals and regulators to create in the workplace opportunities for, if you have a limited license. So I think, Jake, this is a little bit what's happening in the States as well. You enter into the workplace environment with a limited license, and your colleague or another preceptor in the workplace will conduct the assessment in situ, like in the workplace. So that's also a really interesting initiative. So I think, you know, we've been forced to evolve and to really address some of those barriers in different ways now. And that's interesting. The challenge with some of these changes for us as a CELBEN office, for example, are obvious, right? CELBEN is not a test for immigration because it's not a general test. So now we have to rethink the supports that we offer as an occupation-specific language. But regardless, we're really pleased that internationally educated nurses in this instance get opportunities to utilize their skills more fully in our healthcare system.
Well, it's an interesting point with implications for curricula. I know when we think about what kind of curricula specific purposes, occupational language curricula for these kinds of fields are required. And that's an interesting kind of washback effect or effect coming from that. Maybe we should go on to the fourth question. Kate, what do you think?
Sure, I think that actually provides a nice segue into the fourth question, which is geared towards language issues. So we wanted to ask both of you, and Andrea, you may want to start with this because you started touching on it with some of the language-based assessments you were talking about. But for you and Jake, what are specific language-based issues that an organization like CAL in particular could address? What are some of the language-based needs that are out there around this issue?
Can I start? I'll start with the plug for my occupation-specific exams. I do think that it's really important to have the right test for the right purpose, and for nurses to be able to prepare for an exam by thinking about nursing communication is really important. Then it's part of the pathway. It's not a bit of a language detour, right? I think language needs to be integrated with everything we do for internationally educated health professionals. So I strongly believe that if opportunity arises for occupation-specific language testing, let's do it. The other thing that's really important is that communication is a core competency for healthcare. And there's no division between language proficiency and communication for professional practices. It's a continuum, right? So this notion that language proficiency exam is something separate from communication for nursing. I think I really want to continue working with people in the sector around that. Communicative competence, which most of our language exams are based on, and most of what our training programs are based on, this is where it's at. This is how we talk about the skills that you're going to need as a nurse or as a doctor or as a physiotherapist. So it's really important to talk to our peers around what it means to be communicatively effective. The other thing is that I think newcomers put in a huge effort into language training and language upgrading. Could we recognize that effort somehow? Could we give badges and other things on LinkedIn? Could we think about ways to give micro-credentials associated with language training and preparation related to language that helps us perform our work better? I think we need to professionalize, especially when we're working with adults who are headed into the workplace, the way that we sort of credentialize language training. So those are some ideas that I would suggest might be helpful.
I think those are great ideas. I love the idea of micro-credentialing so we can really recognize efforts, and also occupation-specific language assessment. Jake, do you have some ideas you want to add to that?
Yeah, sure. And I think Andrea touched on a really important note here. So our own research at MPI indicates that limited proficiency in English amongst internationally trained professionals is a major driver as to why skill underutilization occurs broadly, both within and outside of the healthcare sector. So I think really and again, Andrea touched on this, but just to expand a little bit. So the issue and potential solution is twofold, I think. On one hand, there are individuals who are internationally trained professionals who may lack sort of a general proficiency in English, which just demands participating in an English language acquisition or ESOL courses until they're able to develop a level of proficiency necessary to sort of take the next steps in their career. So that's more about connecting people to existing services. But I think on the other hand, the sort of more advanced point here is that some ITPs may have a decent level of proficiency in English, even an advanced level, but the challenge for them might actually be more the specialized vocabulary. And also, I think this is really key, the specific cultural knowledge needed to both take the necessary exams in the US and be more employable in the healthcare sector in the US as well. So just in terms of what does that mean around language courses, I think it raises the potential for the development of more specific contextualized English programs that can provide a bridge or an on-ramp to whatever field the ITP is focusing in, including the healthcare field. So in theory, such programs could also be really effective if they were paired with navigation support on how to go through the credential processing and other assistance that can help whatever individual was enrolled both develop their English while also transferring their credentials and finding employment sort of all within the same one-stop shop English program as well.
Jake, there's one regulator in Canada who created two language proficiency benchmarks, a lower one and a higher one. So the lower one would enable them to join the registration pathway and actually do some in the workplace work and some additional credentials until they met the next standards. So I think that was a really exemplary practice that is helpful, because it's fairly complex how to gain those skills while already contributing somehow to a healthcare context, right? That's probably where the magic is, if we could figure that out, because the more you're outside of your sector, the less you're learning about it and the less confident you feel about your ability to contribute your skills. So really creating a pathway or a continuum within the sector is I think really what we need to start thinking about, as you've suggested.
Yeah, and I think that's a great point that in the US context, thinking about how adult education programs, community colleges, and workforce development programs are using stackable credentials and career pathways, and also the ability to pair those with English and models such as integrated education and training, where, as you're describing, Andrea, that folks can be working, that they can be earning and learning, and also developing professional skills, and not just necessarily confined to an English sort of standard English course for an extensive amount of time, all the while not gaining that really critical exposure and experience in the field too.
All right, this has been a very interesting and engaging topic. This is all we have for today. I wanted to say a big thank you to our speakers, our moderators, and our guests. But wait, I think we have time for one question. So we're going to take one question from the Q&A. And we're going to take the question from Mary. Who bears the cost of this English training? Does the government fund it?
I can just comment quickly in the American context that this can include both government-funded programs such as adult education or workforce training programs. In addition, some
I think we lost you,
for
Jake.
credential recognition.
Yep, I believe Jake is having a bit of technical. Oh, there you are, Jake.
I'll just pass to Andrea so she can talk about just to say the US context is fractured, but I would let Andrea speak a little more about the Canadian context.
I'd love to say our Canadian system is better, but I think we also experience some fracturing here. We do have pretty good government funding towards language training. It seems to never be enough. And then there is a lot of pressure around what kind of training and where, right? So we have a language instruction for newcomers to Canada, which is well funded from the federal government, but it's general. And then we have occupation-specific language training, which is also funded from the federal government, which is really, really popular, and it's offered at community colleges. And so we can achieve a lot, but of course we always want more as ESL practitioners, right? We want to be able to do more and to do things that are more focused. But there was another question about how do you go about developing an occupation-specific program, and I think it's really important to have your sector advisors. And what we do in Canada, if the occupation is regulated, is go straight to the professional competencies to understand those and think about the language that underlies those. And in non-regulated professions, then working with the associations and with employers to interview them about what are the challenges faced. In many cases, it's non-technical skills, collaboration, teamwork, all of those things that are informed by culture as well as language. But those are all learnable, and they're things that we can do in our training programs.
Thank you, Andrea. So finally, this is all that we have for today. We thank you all for joining us. We were very excited to have you. I'm dropping in the chat a link so you can tell us how we did. We appreciate your feedback. Once again, thank you to our presenters, to our moderators. Thank you to our audience for your questions, your comments, and especially your enthusiasm. Please feel free to share this message with your coworkers, friends, family. We will be sending a recording of this webinar via your email, as well as any additional resources. We thank you very much for joining us today. Have a great day.
Thank you.
Thank you.